It's over $2 trillion of spending of money that we clearly don't have and can't afford. It's going to increase our deficits and debt and destroy jobs. And it's over $500 billion of new taxes. Taxes on pharmaceuticals, on medical devices, taxes on employers, taxes on workers, taxes on jobs. Imagine, with the unemployment rate nearly 10%, we passed a bill that taxes job creation. This makes absolutely no sense at all. One of the things that's as disturbing as all of that to me is the fact that it's really designed to expand dependency, make people more dependent on government, and less able and less willing to have an independent access and control to health care. So what we should have done, and what we still can do when we repeal this thing, and I think the day will come when we can repeal this thing, is we can have the kind of reforms that will make health care more affordable, more accessible. I've long argued that we ought to give individuals the same tax deduction that employers get. Employers get to deduct the cost of health insurance when they buy it for their workers. That's fine. Individuals ought to get the same opportunity. That would immediately make it more affordable for individuals who have to go out and buy health insurance on their own. Speaking of insurance, I can buy car insurance from a little green lizard, but I can't get health insurance from a guy from New Jersey. This makes no sense to me at all. And we ought to force the insurance companies to compete for our business. This is a big source of the problem. You know, some of the Democrats, they think the only answer is the government. How about some competition? That would make such a big difference. I think we need medical malpractice reform as well, because we tolerate too much litigation. The goal should be repeal of this bill and replacing it with the kind of reforms I'm advocating. But let's be clear. President Obama is not going to sign a repeal bill, and he's going to be the president for at least a couple more years.
Maybe.
But when Republicans take control of one or both bodies of Congress, then there's a new opportunity to control spending. And through the appropriation process, we can and we should and we must deny the funding that will implement these kinds of